Hi everyone, Dr. J here. We're going to talk about blood pressures really quick. Okay, first we're going to talk about blood pressures, and I'm going to be talking to the camera. Okay, I'll be talking to you too. The 120 over 80. The 120 over 80. Okay, how do we understand that to be? People don't understand what blood pressures are. So let's reiterate what we just talked about before. Okay, so we talk about 120 being the systolic, and the diastole being the 80, right? So this is systole and diastole, right? So with that in mind, we have to separate these two numbers. And when the question is always, where do these numbers come from? When somebody takes a blood pressure and they wrap it around your arm, where does the number come from? And that's what we're going to be talking about for the next 15 minutes. Okay, so I'm going to draw the heart for you here, and we're going to draw the four chambers, and this is the right side and the left side of the heart. Okay, so what we're going to be talking about is the left side of the heart, and when we talk about the left side of the heart and the right side of the heart, physiologically, we talk about the pressures of the heart. We don't talk about the volume of the heart. We talk about the pressures of the heart. Okay, volumes are discussed, but when there's a problem with the heart, then we talk about we talk about the volume when there's a problem with the heart. The heart can't pump out the blood, so volume accumulates, and then you get lung problems, and you get right-sided problems and left-sided problems. But we're going to talk about it normally. 120 over 80, the normal heart, and this is how it works, okay? So the left side of the heart has more pressure, correct? It has more pressure than the right side, because the right side only has to pump blood to the lungs. The left side has to pump blood to the systemic circulation, so it needs more pressure to do that. Not more volume, more pressure to do that. So the aorta is the guy that we're talking about. So it comes out of the heart, out of the left ventricle, right? And it comes down. And remember, the aorta is almost like a snake. It has it goes throughout the whole body. Starts from the heart and it goes down into the chest and in the abdomen. So we say that this is the aorta, from the ascending aorta, the aortic arch, the descending aorta. Then we talk about the thoracic aorta, and then we talk about the abdominal aorta, and then it goes down and it bifurcates into the iliac arteries, and then it goes down to the legs, the femoral arteries. So it's a big Highway 95 kind of a thing, and it goes all the way across the whole country of the body. And this 120 over 80 that we're going to be talking about right now, well, where does it come from? Everybody understands it's a blood pressure, I get it, and it's a pressure. Don't ever think of it as volume, it's a pressure. So let's talk about where it comes from. So this is where it comes from, okay? So when the aorta is in the left ventricle, and I'm going to draw this a little wider for you, the left ventricle has a bigger muscle because it has more pressure there, and it's going to contract and send the blood through the aorta. Now, for the aorta to accept that blood that's being sent into it through its mouth, when it first begins, the aorta has to open up its mouth like a big wide mouth, and we call that word compliance. When we have compliance, when there is an increase in compliance, that means the mouth opens up really wide. And because it opens up really wide, the pressure will lower. So this number, instead of being 120, can be 110, can be 100, because the mouth of the aorta is opening up wide to accept this blood that's coming out on that one contraction. And we call that one contraction stroke volume. And it determines that first systolic number. Now, secondarily, it will affect also the heart muscle as well, because remember, if the compliance becomes very low and the mouth doesn't open up wide enough, and that blood still has to go through the aorta, the left ventricle has to contract harder to get that blood out. So this muscle will be affected secondarily to the low compliance of the aortic mouth that's not opening up wide enough, and the pressure is going to get higher. So when the pressure gets higher, the muscle, so now we have now say we get 170/80 instead of 120/80, that means that the muscle, the left ventricle muscle, has to pump harder to get that same amount of blood out into the systemic circulation. So that means that the left ventricular muscle will have to work harder. It will get larger. And long-term effects of systolic hypertension will be a left ventricular hypertrophy, which means that the muscle will get larger and thicker because it has to always work harder. Like any muscle of the body that you work gets larger, well, the heart muscle will get larger. So you'll have left ventricular hypertrophy. And because you have left ventricular hypertrophy, the long-term effect of that will be congestive heart failure, because after a while, having to work so hard for 20 or 30 years of a systolic hypertension of 170 or more, the muscle gets to become fatigued. It gets old quicker, and you start to have congestive heart failure from it, because now the left ventricle can't pump hard enough any longer. It's tired. And because that is true, the valve that is controlling the amount of blood that has to come back, in other words, when we have the blood that is leaving the heart and that aortic valve that's shutting, not allowing the blood to come back to the left ventricle, is now insufficient. And you'll have blood that will be going back into the left ventricle also. And you'll wind up getting aortic valve insufficiency, which will even contribute to the left ventricular hypertrophy, and then you'll start getting congestive heart failure from this. Because remember, when the blood contracts and we have what we call stroke volume, the normal amount of blood that leaves the heart at every contraction is about 65% of that blood that is in there. So that means that out of 100% of the blood that's in there, 65% of it leaves in a normal contraction. That means that 35% is left in the left ventricle. We call that end systolic volume. Okay? And when there is a problem where now the heart can't pump well because it has congestive heart failure, now you're going to get a stroke volume that's not 65%, but maybe 40%. So now you have more blood left in the heart in your end systolic volume. So now you'll have 60% left in the heart, and only 40% being sent out into the systemic circulation. So eventually this will get worse because the heart is not getting better. It's sick, and when something is sick, it'll only get more sick as time goes on. So we have to be careful about keeping your heart healthy by lowering your systolic blood pressure. You understand that? And remember, to get this systolic number lower, all we have to do, and this is if it's normal, say it's normal, the compliance of the aorta opening its mouth will lower the systolic volume. So I can reiterate and say, if the compliance is high, the systolic number will go lower. So instead of being 120, it can be 110. It can be 100 if the compliance is high. The dilation of the aortic mouth, opening its mouth to accept that blood through the aorta and into systemic circulation, and the pressure of the ventricular muscle doesn't have to be so high. It just, because it's opening its mouth so wide, it just pushes it out very easily, and your heart can be saved. I mean, you're talking about long-term effects. And being systolic hypertension, the long-term effects of it are congestive heart failure, and because the pressure is so high, it can also affect the kidneys. So kidney failure is also part of the long-term effect of systolic hypertension. Okay, I hope that's very clear to you. Now, with that number being said, let's talk about the diastolic number. The diastolic number occurs when not the compliance of the aorta sending out. But the valve that's shut after the after the stroke volume, after the contraction, remember, systole is rest, right? The valve shuts. There's two little holes behind that valve, and these are for the coronary sinuses, the coronary arteries. And when the systolic number, now let's say the number is not 80 anymore, say it's 140 over 120. Now this is a very bad diastolic number. And when that happens, these two little sinuses can start to squeeze really tight. And that means that when that happens, the coronary arteries will not get the oxygenation that it needs during its rest. And that pressure will start to squeeze these little holes very tightly, and you'll get a lower amount of blood and oxygenation getting to the coronary arteries, so you can get a heart attack very quickly with this. And I needed to mention to you also, going back to systole, is that when the systolic pressure is 220 over 80, that's a systolic hypertension. That is a malignant number. In other words, what can happen to you today with a 220 over 80, rather than the long-term effect of the congestive heart failure and the kidney failure? What's today's effect? Well, you can get a stroke, because remember, the high pressure is affecting these three in that aortic arch. The brain is being affected. It's right there. The brain's right here, and that brain can get a stroke from the high systolic pressure. So today you can get a stroke. Long-term effect with systolic hypertension is congestive heart failure and kidney problems. But in diastolic, you can get a heart attack today with that number of 120, because if you squeeze that number if you squeeze these coronary arteries, these coronary sinuses too much, you will deprive the heart of getting the blood supply, and then you'll hit a heart attack right now. So remember these two numbers. So remember, systole is the compliance and the ability for the blood to go through. This is systemic circulation without high pressure. And then you have diastole, which is the number that is in rest for the coronary sinuses to be fed their oxygenated blood. So there's two different numbers here that you must understand. One's systole, one's diastole. Where these numbers come from? From the aorta. That's where the number comes from. Okay? And now you can read about that. So that's the story. And remember, the aorta is like a snake. Whatever happens here happens also down there. That's why the kidneys get affected by the hypertension as well, not just from the heart. And remember, the compliance of the aorta determines the systolic number. The compliance of the aorta determines the systolic number. Remember what compliance is: the dilation of the aorta, opening up its mouth to allowing all that blood to rush through and get into the systemic circulation. Okay? Diastole is the resting, where now the coronary sinuses are going to get fed their oxygenated blood during rest of the heart, which is when it's supposed to when it should happen. And that pressure is very dangerous, and we have to medicate them to get this down. And remember, we just have to dilate the aorta. So what do we do for that? ACE inhibitors, vasodilators, right? Beta blockers. These are all part of the regimen of trying to lower the systolic and diastolic pressure. Calcium channel blockers. This is all part of the scheme, and there's multiple cocktails of medication that you can use that can be used to lower this blood pressure. And remember, as you get older in life, your aorta naturally stiffens up. It's a physiological phenomenon that the arteries just don't expand much anymore because they lose their elasticity. So, having a blood pressure of 160 over 90 for an elderly person is not the worst thing in the world. But remember, we don't want to give them too much medication, because remember what happens with elderly. They take their medication and then they take it too much and they wind up getting hypotensive, and they wind up getting they wind up fainting, and they wind up getting orthostatic hypotension in the morning. So remember what I'm telling you about the elderly versus the young person who has hypertension throughout his life. And usually people in their young ages don't get a hypertensive medication, but if they do, it's in their family, it's in their DNA. You got to treat them. Don't let hypertension linger. Treat it, treat it, treat it. It's a silent killer. It doesn't affect people that are constantly having this constant hypertension because they don't realize it's happening to them, and all of a sudden they wind up getting all kinds of problems later on in life. Okay, so that's what that is. So I want everyone to remember that. That's what that is. Let's stop the video.